It's a pleasure to be here. I'd like to thank the Anti-Aging Society for inviting me. It's certainly a privilege to be here speaking amongst the fantastic and well-educated speakers that we have at this conference. For the next 4 or 5 hours, I'm going to be talking about how to change men's health, and then for about the next 3 weeks, I'm going to talk about testosterone. You're laughing. I hope you're comfortable. Okay. I have nothing to disclose. I have no relationships with anyone except my wife and my 2 daughters. Okay, so in all seriousness, I took 3 lectures and condensed these into a 40-minute talk. So here we go. I'm going to talk about some of the challenges in delivering appropriate health care for men. Okay, just so that I'm in the right place, how many of you care for male patients in your practices? Okay, 2 hands, that's good. I'm going to outline some of the current evidence-based screening guidelines according to the United States Preventative Services Task Force and specialty societies. I think what's important is to understand how to counsel men on improving their health care. It is that basic. We're hearing a lot of fantastic lectures relative to anti-aging and wellness and longevity. One of the key factors is just getting men in and in speaking with them directly and motivating them. I'm going to talk about current guidelines, current media opinion, and best practices for addressing men with testosterone deficiency. And then I will end with highlighting some of the controversy currently surrounding testosterone replacement and cardiometabolic disease. Okay, what do we know? So if you go back about a decade, and unfortunately we don't have a lot of new data, but hopefully we will, we know that male gender is a major determinant of public health, US, Europe, Asia, and worldwide. US is one of the few areas that does not have a specific men's health report summarizing the challenges and the problems in delivery of health care for men. European Union has one, India has one, Asia has one, hopefully we will have one. We know there's major health disparities in terms of caring for men. NIH has a multi-billion-dollar budget for their Office of Women's Health. NIH does not have men's health. There are discrepancies. Those discrepancies can't solely be explained just by biology. There are behavioral issues. We know biology and molecular biology play some role, though. We need a deeper understanding of what influences healthcare decisions and behaviors of men. And then the global healthcare community at large must be willing to impact this culture. About a decade ago, I got really manic one weekend, and I said, you know what, I'm going to do a textbook on men's health. Before you do that, if you're going to go home and write a book, sit down and plan out a timeline. That was the one problem I didn't do. So I figured the best place to start was I'd go to work, and I would ask one of my patients, so I want to do a book on men's health. What do you think about men's health? So I asked a patient. He said, well, you know, guy problems, prostate, genital stuff, heart attacks, strokes mostly. Maybe they go to the gym, maybe they don't. Men get cancer, and they take really stupid and risky behaviors. Guys like to take chances. They don't always think about what might happen to them, and that should about cover it. So that's kind of superficial, but that's a good starting point. I do a lot of media work. When I'm asked questions in the media, I'm professional and I'm polite, and I try to keep it at least close to G-rated. I don't like to be upstaged, though. And so one of my colleagues, when we were asked about what is important in men's health, I think what I said was something like, you know, physicals, or something true, but something basic. So one of my colleagues says, look, the penis is the dipstick to men's health. That's what's going to get guys into the doctor, okay? Not to be disproven. This is a rhetorical question. I don't need any hands. I don't need any comments. But is being man a disease in and of itself? One of my mentors, Siegfried Marin in Vienna, Austria, a number of years ago did some epidemiologic and statistical analysis and found that the potential number of years life lost for men under 70 was double the female data, about 6,000 per 100,000. Asking the question, is being a man dangerous in itself, molecularly, behaviorally, biologically? And can things be done to improve the life expectancy of a man? There are countries, even in the European Union, where the life expectancy of men is in the 50s. It's in the 50s. The gap in life expectancy between men and women, in many of those countries, has widened. It hasn't narrowed. And it poses the question, are there effectively and morally acceptable strategies to teach a man how to modify potential harmful and or negative behavior? No better place than Las Vegas, Nevada to ask this question. It could be estimated that 50% of male deaths each year could be prevented through positive changes in personal health practices. That's where we come in. Motivational interviewing, time spent with our patients. It's challenging. Men remain underinformed about their health. One of my colleagues just